Hello everyone, welcome back. I'm Dr. Gupta and a medicine specialist from India working in Australia currently. And if you are a specialist from India or any other country and you're thinking whether you should go with a standard pathway or specialist pathway, this video is for you. If you haven't subscribed to this channel, subscribe now and hit the like button. In this video, we're going to talk about your specialist pathway. So in specialist pathway, I'm going to talk about eligibility criteria, expense, outcomes and the journey about the outcomes. So let's talk about the criteria. You're eligible if you have done 4 years of your specialist training or 3 years of training plus 3 years of consultant experience, not the SR1. So these are the eligibility criteria. If you fulfill, you can apply for overseas trained physician form, OTP form. And after that you sit in the interview, and the expense for the whole process, for the form submission to interview organization, you have to pay around 7,000 Australian dollars. And after that you sit in an interview and the panel of 2 to 3 doctors will interview you based on your application, and the outcomes will be no comparability, partial comparability or substantial comparability. Getting substantial comparability is a bit difficult, but most likely you can get a partial comparability if you are from medical background. So after getting partial comparability, you'll have to do a top-up training of 1 year in which you'll be working as an advanced trainee, final year advanced training in your branch. For example, if you are a cardiologist and they want you to do a top-up training of 1 year, you have to work as 1 year of advanced trainee cardiology. But getting that position is quite tricky. Nobody leaves that branch and the vacancies of final year are very limited, and it based on the luck as well. So after doing that, you go for peer review. If you are substantially comparable, then straight away peer review, you work as a consultant and your peers, your colleagues will be reviewing your activity and how you're working as a doctor. So this is the outcome and the procedure. But getting your first job as a consultant or a senior registrar after you got the comparabilities can be tricky, and maybe you are stuck in your home country with substantial comparability but no job in Australia as a specialist because you are not their specialist. You need to be reviewed by your colleagues. So this is the tricky part. If you have just completed your MD or few years of experience as consultant, or even if 3 years of consultant experience, I would say go on the standard pathway first and then you choose the specialist pathway. I'm gonna tell right now. So if you are a specialist and you don't want to go for specialist pathway initially because of your lesser experience or not so confident profile, or you are young, then clear AMC1 and English exam and start applying for jobs. Once you find your job, come to Australia, work in your dream branch or the branch you have done your specialization into, and after that you'll have some good consultants here who will be motivating you or push you after looking at your work that you are a consultant material or not. And after that you'll get your local referees. You know the system, Australian healthcare system, you know the department, how the patients are coming here, what sort of patient profile and symptoms that they are common in this country. Then you go for specialist assessment and get your comparabilities done. It will be easier for you to find an advanced training position once you are in the Australia already working. So don't rush into specialist pathway, go for standard first. This is my opinion on going for all the comparabilities and things. But if you have any specific doubts, comment below. I'm happy to answer. And for personal messages, you can go follow on my page Dr. Gupta MD or AMC by Dr. Gupta and DM me. And better to comment on this video so that everybody can see your comment and my reply on that, and this video can be helpful for a lot of doctors. So hit the subscribe button and like this video. See you next time.